Okay, so hoarding is keeping an excessive amount of possessions and having a difficult time throwing them away or parting with them when they are not useful or necessary anymore. For younger children, it is seen that they often hoard due to underlying anxiety disorders. Hoarding is considered a mental health concern when there are problems that lead to severe amounts of clutter, safety, and/or health risks, which could lead to impairment in day-to-day living, or when a person's health and safety are jeopardized due to mass amounts of chaos and a lack of organization, or when these things cause large amounts of distress in one's life. Hoarding can also be a sign of depression, social isolation, emotional deprivation, and schizophrenia.
Okay, let's play.
Hi, my name's Rebecca Kettyle, and I'm going to talk about my personal experiences with hoarding. When children of this age are hoarding, you really have to take a look at why they are doing so. I had a child in care that was 5 years old and was a hoarder, and the reason that she was hoarding food was because she was severely neglected, and because of the neglect, she was always worried about where her next meal was going to come from. This is when she came into our care, and we had to try to break the pattern on hiding food under her bed. We created picture symbols of food that we noticed that she was hoarding the most. Laminated the Every morning this little girl would get up and we would let her pick from the picture symbols of all the food that she wanted that day and told her that at any point she could have the item that she picked. We actually turned this into a game that when she picked something from the list, we would pick something else that went with that particular food she picked. It was play therapy for her because she had to guess what we picked off the list that would go with the food that she chose. For example, if she picked a hot dog, we would pick a bottle of ketchup and then she would have to say what we picked. When she would guess the right answers, we would give her jelly beans, her favorite snack. The purpose of doing this activity with her was to let her know that she was in control of the choices around food, and whatever she picked of the picture symbols, she had access to whatever she wanted. She started to realize after a while that she was going to be able to eat and that she didn't need to steal and hide food. It took us about 8 months of working with her that she started to slow down on her hoarding tendencies and feel that she was going to be able to have access to food.
When working with a child at the age of 7 to 9, one might suggest making songs and games about cleaning or give them fun tasks. A song might be something as simple as the cleanup song. The caregiver and the child can sing together as they tidy things up and put them away. The goal is to keep the song simple and on topic. It could be something along the lines of clean up, everybody come on and clean up. Put the toys in their place, take the garbage to the can, and fold your clothes. Clean up, everybody come on and clean up. This way the tasks are stated and the goal is clear. Another way to make children feel like they are involved is giving them tasks. The tasks given to the child can be big or small. It could be taking the garbage to the curb on garbage night, helping to do the dishes, planning and organizing a garage sale, or organizing items that can be donated to other children. The reason a caregiver may want to do these things with a child who is struggling with hoarding is the simple fact that they are fun for the individual. Discarding items or organizing them can be difficult for anyone who has troubles with hoarding. It is suggested to never touch the belongings due to the fact that it can create more distress and anger within the individual. Singing songs with a child when they need to clean up gets them doing it on their own. It also shows them that it can be fun and doesn't need to be stressful on himself or herself or the caregiver. If the song is short and simple, it makes it easier for them to remember and enjoy. Giving a small child tasks to do can also be fun to an extent. It gives them a sense of responsibility and belonging. Tasks involving cleaning and discarding of items shows them that it is okay to let go of these things. For a small child like this, giving rewards after completing the tasks, such as a small celebration, can also help to give them encouragement.
The age of 12 is when the first peak for OCD of hoarding occurs. It is said that changes of the brain and body occur along with school and performance pressures. In personal experiences, when I was younger, around the age of 12, I would keep a lot of things that meant a lot to me. As parents would call me a pack rat. They thought that an easier way to keep things less cluttered for me was to keep these items organized. Without throwing everything out, they decided to sit down with me and go through the items and decide which ones I do not need to keep and which ones I can part with. A good strategy to stay organized was to get memory boxes, almost like a shoebox, to keep these items and look back on them when I wanted to. Another strategy that could work for kids would be scrapbooks. Obviously, now that I'm older, I did not keep all these memories, but I now have the knowledge of keeping things organized and have a small shoebox of my memories from high school. I think this is a great way to teach kids organization skills and help them deal with hoarding and or OCD.
For the age of 16 to 19, an intervention for the OCD of hoarding would be to collaborate with the youth, teachers, caregivers, physicians, and anyone who has contact with the child on a daily basis. Chances are that if the child is doing these behaviors at home, they would be doing them outside of the home as well. Some places would be at school, church, etc. It would be beneficial to have a family meeting with all the people listed above. Reasoning for this would be that it's important that everyone is on the same page about how they're going to either handle this youth hoarding problem or how they're going to fix it. Odds are that if the youth is hoarding things such as food, it can be linked to binge eating disorders or bulimia nervosa. If these are linked together, it is important to seek help from a physician or psychologist with specialization in such clinical issues. There is no reason to feel ashamed at the fact that you are seeking professional help at this point. The best for the youth would to do whatever you could to help them.